Good afternoon, everyone, and thank you for joining the Lewy Body Dementia Association for today's webinar. My name is Angela Taylor, and I'm the Director of Programs at LBDA. I'm happy to be serving as your host for the next hour, and our topic today is partnering with your medical team in Lewy Body Dementia. Now, before I introduce our guest presenter, I have a few housekeeping announcements for you. If you haven't already, please participate in the poll. It should be showing on your screen right now, and if it's not, you can click the polls button at the bottom of your screen to see it. It's just a one-question poll related to our topic. We'll share those results with you later on in the webinar. If you have any technical problems during today's event, such as not being able to hear the audio, please post that problem in the chat window. Again, there's a chat button at the bottom, and that way one of our team can respond to you. So that everyone is able to hear today's presentation, you'll notice that all attendee lines are muted, and that will remain the case throughout the event. While we're not providing copies of the slides from today's webinar, we are recording it, and so the webinar will be available on YouTube for sharing and for any on-demand viewing. So you'll get a link to the recording, and we hope that you'll pass it along on social media. Today's presentation will be followed by a question and answer session. So as Dr. Armstrong is going through her presentation, if you have any questions that come to mind, you can type them out using the Q&A button at the bottom of your screen. Submit those during and throughout the webinar, and when we get to the end of her presentation, we'll go through as many of those as we can during the time that's allowed. Okay, so our presenter today is Dr. Melissa Armstrong. Dr. Armstrong is the director of the Mangurian Clinical and Research Center for Lewy Body Dementia at the University of Florida's Health Fixel Center for Neurological Diseases. And University of Florida is also one of LBDA's research centers of excellence. Her clinical work and research focus on improving care for persons with Lewy body dementia and their families, including increasing Lewy body dementia awareness, identifying individual priorities for care, and improving end-of-life experiences. So welcome, Dr. Armstrong, and thank you for joining us today. If you could, please take it from here.
Before I get started with my presentation, I just have a slide about disclosures. None of my disclosures relate to this presentation, but I do have some research funding from the Agency for Healthcare Research and Quality and from an ADRC pilot grant. I work for the American Academy of Neurology on their guideline program, and I receive some royalties for publications about Parkinson's and for education for physicians. So the topic of the webinar today is partnering with your medical team. And broadly, we are going to cover 5 topics: the importance of knowing yourself and your loved one, helping your medical team know you so they can partner with you more effectively, identifying who your team is. And when we talk about team, we're going to talk about both your medical team and your broader team, how to partner with your medical team, and then the importance of reassessing these things as you go along in your Lewy body dementia journey. So we're going to start the webinar by talking about the importance of knowing yourself and your loved one and helping your medical team know you. Now, if you haven't had the chance yet to answer that poll question, I would encourage you to do so. So we're interested in knowing about whether you've discussed your values or goals with your medical team. And we'll talk about later in the webinar how medical team is a broad term that we'll mention both your physicians, your therapists, and others. But if you're not sure, you could focus on your physician encounters for this question. So take a moment to answer, and then let's see what the poll is showing so far. Well, I'm not sure that I can see the poll results, but we can come back to that at the end, and then hopefully if that's not something that you have been doing to date, you will do it after this webinar. So why are we talking about the importance of partnering with your medical team? Well, it's because every person with Lewy body dementia is different. And those of you living with someone with Lewy body dementia are all different. And so the types of care that you will need and the types of decisions that you are facing are going to be different from someone else on this webinar. So you're going to be different because of the Lewy body dementia itself. So by definition, everyone living with Lewy body dementia does have memory and thinking difficulties, but some will have hallucinations. Some will have delusions where a person firmly believes something that's not true, even when they are presented with evidence to the contrary. Some will have depression or anxiety. There will be varying degrees of movement or Parkinson's symptoms, stiffness, slowness, shaking, trouble with walking and falls. Some people will have sleeping problems where they act out their dreams. That's called REM sleep behavior disturbance. Some will have daytime sleepiness where they nap all day long. Some will have that low blood pressure when they stand up, which makes them dizzy or even faint. And even for people who have similar patterns of symptoms, they're going to be different severity in different people. And so the very nature of the disease itself means that you're going to have different things that need care for from your medical team. But it's not just about how the disease varies from person to person, but we know that everyone who lives with Lewy body dementia is different. So some will live alone, some will be married, some will have children or grandchildren or even great-grandchildren. The environment in which you live may be different. So some of you may have multi-level houses, and so you're going to have to navigate stairs. I live in Florida, and some of my patients live on the beach and complain about how hard it is to walk in the sand. You'll all have different interests and hobbies. So some will be gardeners, some will have loved to travel, some will be painters. And it's this part of your uniqueness that is important too. So everyone is different with regards to the disease, and everyone is different with regards to their families and their circumstances and what they love to do. And all of these things are important and have important implications for partnering with your medical team. So when we think about values and preferences and knowing yourself, it really is different. There are different elements to that. So one element is thinking about what is important to you and your loved one. And this will have some elements just related to your life. So do you do everything thinking about your spouse or your kids or your grandkids? It may be your hobbies. It may be your social activities. There are also elements of your disease that are going to be important to you. So how well are you sleeping? Are you anxious, or is your loved one anxious and your team needs to target that? Is the goal to maintain as much independence as possible? And then also, what is your life like? What is your home like? What's the support structure for the person with Lewy body dementia? Spouse, family, friends? Is the main caregiver someone who's still trying to work outside the home, or someone who is a stay-at-home caregiver? All these different elements are important for making medical decisions. It's also important to think about what the caregiver needs. So do you need more sleep? Do you really just need a break? Do you need to understand what's coming next in your loved one's disease? And then also think about what's coming up in your life. Retirement, a wedding, a family visit, or are you as the caregiver, do you have a medical need such as surgery? And these things all have implications for your loved one's care. Now, hopefully you have a great medical team that is surrounding you. But even if you are being seen at one of the LBDA's research centers of excellence, even if you have a great medical team outside of that program, your doctors still don't have a crystal ball. And so it's important for you to discuss these goals or these needs with your medical team. And in a few slides, we'll look through examples of how this might happen. Before we do that, let's talk about the medical team. So when we think about the medical team, there are a lot of different people in the medical realm who are helping take care of the person with Lewy body dementia. So often we think first about physicians. So that could be the primary care physician. They are so important in medical care, every aspect of care. There's the neurologist, who is often caring for the Lewy body dementia itself. There may be other clinicians, such as a neuropsychologist, that's the PhD who does memory testing. There could be a psychiatrist who helps deal with anxiety or depression or the hallucinations. The medical team may also include a social worker. It could include a support group. Certainly you as a caregiver or as a family member are part of the medical team, both supporting the person with the disease, but also interacting with these other team members. And then therapists are an important part of the medical team for someone with Lewy body dementia. And that includes physical therapy, occupational therapy, and speech and language therapy that deals with speech and swallowing. When we think about the team, though, really the team surrounding the person with Lewy body dementia and the caregiver is broader than those medical team members I just mentioned. So, you do have those medical team members we talked about, the neurologist, the primary care physician, the therapist, and other clinicians. But other people that are part of the broader team can include community resources, home care workers, memory care or skilled nursing when someone can no longer remain at home. And it also includes other family members, neighbors, friends, church members. There really is a very wide team of people that can be involved in supporting and caring for those living with Lewy body dementia. So let's look at an example. Let's put these first few things together and see how these things work together. So this is Jackie, and Jackie loves to sing. And this is really a big part of her quality of life and a hobby that she's had for a long time. So how might this look? How can we help her with this value, this goal, this hobby? Well, Jackie and her husband mentioned to her physician that she loves to sing, but she isn't doing it as well anymore. Her voice is quieter, some of her speech is slurred, and so her physician refers her to speech therapy and also to the local social worker. The speech therapist works with Jackie using the loud voice therapy technique that's also called the Lee Silverman technique. And the social worker refers Jackie to a local community choir. That community resource is the Sing Here Now choir for individuals with dementia. This is a program that's available in some communities. And a church friend also helps by bringing Jackie to her weekly church choir practice, and that gives her husband a break. So you can see that by discussing this thing that Jackie loves to do with different members of her team, there can be this approach targeting that value from different directions in different ways. Let's look at another example. This is Jesse. And Jesse's big problem right now is that he is having trouble showering. So he and his daughter bring this up at their medical appointment. And again, we can see how different team members can help target this problem. So already, the caregiver is a very important team member in this regard, providing regular assistance with bathing and showering. When they bring this problem up with the physician increases the carbidopa-levodopa, the Sinemet, in case part of the problem getting out of the shower is stiffness from the Parkinson's symptoms. The physician also refers Jesse to get home therapy because it's very hard for him to get regularly out of the house to therapy, visits, and other appointments. The home occupational therapist then does a home safety assessment, figuring out what kinds of devices might help Jesse at home, and makes recommendations for those devices, especially for ones that will help him with showering. And I've shown one of those options here. This is a kind of bar or railing that can actually be added to a tub that will help Jessie get in and out of the tub more safely. The physical home therapist also works with Jessie for strengthening exercises and techniques that will let him get in and out of the tub more easily. And then finally, Jessie and his daughter discuss the problem at a support group where participants in the support group mention other strategies they've used in their own lives. The final example I have is of Susan, and Susan is not sleeping at night. And because Susan is not sleeping at night, her husband, John, isn't sleeping at night either. And as I'm sure many of you on the webinar know, sleep problems are a very big issue in Lewy body dementia, both for the person living with the disease, but then also for the caregiver. It's hard to be a good caregiver when you're not getting rested yourself. So they again bring this up with their team. So the physician has a couple ideas. The physician recommends a medication called trazodone at bedtime for sleep. Now, trazodone is a medication that is not FDA approved for sleep. It's actually FDA approved for depression, but lower doses of trazodone, doses lower than are usually used for depression, are commonly used off-label for people with sleeping problems. And in general, trazodone is felt to be safe, even in older individuals and those with memory and thinking problems. So Susan's physician thinks that this medication is worth a try. The physician also recommends a mat alarm for the side of the bed. And I actually show a picture of one of those alarms here. So this is just something that can be purchased off Amazon. And it is touch sensitive, so when something steps on this mat, it plays an alarm or music to let the other people in the home know that someone is stepping on the mat. And this can sometimes be helpful when someone with Lewy body dementia wakes up overnight and tries to get up and go to the bathroom on their own, and the spouse really sleeps lightly, worried that if the person with Lewy body dementia gets up on their own, they might fall. And so John, in this case, was sleeping very lightly because he was always worried that Susan was going to get up without him. And by having a mat alarm at the side of the bed, John could sleep more deeply knowing that music would play if Susan ever tried to get up on her own. The physician also asked social work to get involved, and social work provided John and Susan with information on local agencies providing aids for in-home care. Now, this type of resources often pay out of pocket, so it's not something that everyone can do. But if you do have the resources, some patients and families with Lewy body dementia will have a carer come in overnight so that the spouse can sleep. They also made use of a community resource. So they signed up for an adult day program, and that kept Susan active during the day. And because she wasn't napping as much during the day, she then started to sleep better at night. They also worked with their daughter, so their daughter started coming over one night a week to stay with Susan to make sure that John would get at least one good night of sleep a week. And they also discussed other strategies and support with their support group. So with all three of these examples, you can see that the individuals and their caregivers brought a goal or a priority or a need to their medical team and to their broader team. And in doing that, that goal and that need could be tackled in many different ways. And this is often particularly important in Lewy body dementia because we don't have a lot of miracle approaches. We don't yet have a cure. Often one thing isn't going to be the total solution. And so by making use of different team members, we can target problems or needs or goals from different directions. Now, before I move on to the next slide, I want to give you those poll results. You may see them on your screen. So 45% of respondents said that they have discussed values or goals with their medical team. 24% have not, and then 33% are not sure. So hopefully by the end of this webinar, you'll have some ideas about how you can do that, especially if you haven't done it yet. So now we've looked at the importance of knowing yourself, of sharing that information, especially needs and goals with your team. And we've talked about what your team might look like. But how does this partnering practically happen? So when we think about partnering with your medical team, there is a concept called shared decision making. And shared decision making is the idea that we're going to make the best medical decisions for any given individual in a given circumstance by having a partnership between the patient and the family and the medical team. And within that partnership, we consider the patient's values and preferences alongside the best medical evidence to make the best decision for that person in that circumstance. There are different steps or outlines for how to do shared decision making, and this 5-step approach is adapted from the Agency for Healthcare Research and Quality SHARE approach. And if you want to learn more about the SHARE approach, you can do that through the AHRQ website online. But we're going to talk through what these 5 steps look like. So the first step is knowing your values and preferences. The second step is bringing your concerns to your medical team, asking questions and participating in those encounters. The third step is to explore and compare options with your medical team. The fourth step is reaching a decision, and the fifth step is reevaluating. So let's take a closer look at each of these steps. So the first step is knowing your values, preferences, and goals. And this really overlaps with what we've been talking about already in this webinar. When you think about your values, I encourage you to think broadly. So you probably have some global values. Those are overarching values or even personality traits that will impact all decisions. So some people have religious values that affect all decisions. Some people make every decision in the context of thinking about how it will also impact their family. Some people have personality traits that impact all decisions. I have some people who always want to try the new thing. And I have other people who are risk averse. They only want to try something that's been around a long time, or in some cases, people prefer to avoid medication altogether. And those kinds of values impact every decision they make. There are also decision-specific values. So this will be how much weight do you put on how much this medication might help you, or how worried are you about those side effects, or might cost play a role, or how you take the medication play a role. Those are all values that are really going to be tied to a specific decision or a specific option that's available to you. External values are when you or your loved one might consider another person's values in addition to their own or even in place of their own. So the most common example I give of this is of a gentleman who has cancer. And he kind of feels like he's lived a good life. You know, he doesn't know that he needs to go through chemo. He's happy with the life that he's lived. But his daughter comes and says, Dad, I really want you to undergo treatment. You know, this is really important to me. And so he decides to undergo chemotherapy because of her values more than what he might do for himself. And the final type of value I talk about is situational values, because there are elements of our lives that change based on the situation. I had a patient with Parkinson's disease who had a tremor that was obvious, but it never really bothered him. And so while we were treating other elements of his Parkinson's disease, we never really chased treating the tremor. But that all changed when his daughter got engaged and he started thinking about the wedding, and he didn't want his tremor to distract from his daughter's special day. And so that situation changed what his values were and made us think differently about this question of how we tried to treat his tremor with medication. So when you think about values in the context of your medical decisions, I encourage you to think broadly about different kinds of values that might impact the decisions that you make. It's also important to think about what goals you and your loved one have for the next month or the next year, and also to think about what events are coming up in your lives. And this can be really important to discuss with your medical team. So one example of this from my own clinic is when one of my patients and their families tells me that they are thinking about a family visit or they have a family visit coming up. And this really shapes the kind of conversation that we will have at that clinic appointment. So if I know that there is a family visit coming up, we talk about strategies to make that successful. Because as you probably have experienced, it can be very hard to have a family visit or a family reunion with someone who has Lewy body dementia. So we talk about how it's important that you make sure that your family has realistic expectations for the visit, and they don't expect more than you can really do with your loved one. It's often helpful to give tips to visiting family members about what to do and what to expect. So if you've figured out the best way to handle hallucinations, and the hallucinations are common, those are strategies that you might want to share with your visitors. It can be helpful to prioritize familiar places. It's so much easier when a person with memory and thinking problems can stay somewhere they know and maintain their normal routines. And so we often talk about how it's helpful if you can stay at home and host the family, but maybe rather than bringing everyone to your house, which is a lot of work for you and which can also be hard for the person with dementia because there's always someone around. You know, you can have family stay at a local hotel or at an Airbnb. So you're in your familiar place, but your family is nearby. It can be helpful to consider short rather than extended visits, and that's true both of the number of days, but also within the day. So it can be helpful to hang out as a larger family in the morning with your loved one, and then in the afternoon send your kids and grandkids back to the hotel where they can play in the pool and your loved one can have a break. Stay as close to the normal routine as possible, but find ways to involve the person with Lewy body dementia so that they feel part of the visit, maybe even planning some special activities that you know they can do with the grandkids. It's very important to plan breaks. So maybe if you hang out in the morning, then the person with Lewy body dementia can have time by themselves or time to have a nap in the afternoon before the family gets back together for a late afternoon snack or an early dinner. And then evenings can often be very difficult for someone with dementia, and so avoiding big group evening activities can be helpful. And we know that sometimes people with Lewy body dementia can really rally themselves for a visit. So they may even look better than usual when the family comes. But that's often followed by a real letdown afterwards where they're very tired and things can get a little bit worse before they get better again as they recover from the event. So if I know that one of my patients and families has an upcoming visit, that is really important for how we'll conduct that clinic visit because we'll go through some of these different strategies. The second part of that 5-step approach is to participate in each visit, and there are different components to this. So you do want to bring your notes and questions to the visit so that you get the most out of those visits as you can. So what do you need from the team today? And there are different resources you can use for this. I have one example here on the screen. This again is from the Agency for Healthcare Research and Quality, and you can actually print this or order cards with these questions. It asks you to think about in advance your top 3 questions for the visit. Now, you don't need a special notepad to do this. You can just jot down your questions on plain paper, but it's helpful to think in advance about what you need from that medical appointment so you make sure that you make good use of the time. There's no reason you have to be limited to 3, but it can be helpful to really think about the top 3 things because your medical team may not have time to discuss 15 things in your appointment, and you want to make sure that the things that are most important to you are the things that get covered. You want to make sure to communicate with your medical team, that you ask questions if you don't understand something or if you're uncertain. And sometimes it can be helpful to bring another set of ears, another partner, a family member, a friend, or advocate, so that multiple people there are there listening to what the team has to say and asking questions. The Lewy Body Dementia Association also has a printable checklist that you can use to prepare for visits. You can get this on the LBDA website. And there's a list of different symptoms your loved one might be experiencing that you can check off if they have that problem or if that problem is new. And then there's also a space for comments where you can write in things you want to make sure to share with your medical team or questions that you want to ask. The third step is exploring different options. So for any problem that you bring up or any goal that you want to target, hopefully your medical team will have some ideas about how you might do that. So for those different options, you want to think about what are the pros and the cons. How much might this help, and what's the likelihood that it will help? What are the possible side effects? And then what other parts of the decisions matter? So often we worry about, well, how much is that really going to cost? Or if it's a drug the doctor is recommending, how is it taken? Is it a pill? Is it a patch? All these different things may affect your decision. It's important to remember that doing nothing is always an option. So even if you've identified a problem or something that you want to target, if none of these options match you well, you don't have to do something, and sometimes doing nothing is the best option. And as you talk about these different options, think about how they intersect with your values and the values of your loved one in order to make the best decision for you. That fourth step is reaching a decision. So which decision is the best intersection of the different options and your goals and values and your loved one's goals and values? Keep in mind that there's often no rush to make a decision. So, it is nice to make a decision when you're sitting there with your medical team, but if you're not sure, you don't have to make the decision right then. When you do reach a decision, make sure you understand the plan. Most doctor offices now give out something called the after visit summary for you to take home. That can include things like blood pressure, heart rate, and the medications the doctor marked that you were taking. But you can also have your physician or your medical team write down a few notes about what was discussed at the visit, and make sure you ask questions if you need to understand the plan. Also keep in mind that you can always change your mind. So if you reach a decision there when you're sitting with the doctor, but then you have a 3-hour drive home and you talk about it more and you're like, that maybe this isn't a good option for me, you can always change your mind. And then that fifth step there is reevaluate. And that's also the fifth step from this webinar. Reassess and reevaluate the decisions you've made and also things like your goals and priorities. So when we think about reassessing and reevaluating, it's important to think about, is the approach we chose working? If not, do we need to try something else? Or if it's not working well enough, do we need to try something else? Are there new concerns we need to address? And then also think about, are your values and priorities changing? There are many different examples of needing to reassess and reevaluate decisions or concerns or values. But one way this commonly comes up is that your priorities for care may change over the span of Lewy body dementia. So if you are early in your Lewy body dementia course, you may be saying, how does my loved one maintain their hobbies? How can we keep him gardening? How can we keep her traveling? How can we keep doing these things, these social activities that we love to do? But as the Lewy body dementia progresses, some of those questions and some of those goals are going to be different. And at the end of Lewy body dementia, you may be thinking, how do I make this end the end that I want it to be? And so one example is when we change the values and priorities we're looking at, we start thinking more about things like palliative and hospice care in Lewy body dementia. And this is directly from the Lewy Body Dementia Association website. So palliative care is actually relevant for many elements and really along the course of Lewy body dementia, because palliative care is really about prioritizing quality of life by relieving symptoms, especially when there's no cure. So that's relevant for everyone because we all want to improve the quality of life of people living with this disease by relieving the symptoms with medications or other strategies, regardless of where the person is in their LBD. But as the disease gets worse, palliative care has increasing meaning, and we think about hospice more in the last 6 months. And so that 6-month mark is really something determined by Medicare and adopted by many insurance companies. It can be hard to guess when those last 6 months are in Lewy body dementia, but there are ways to estimate that. And then hospice is really about targeting quality of life at the end of life. And when we think about palliative care and hospice care, that also involves a team. So that brings back some of the concepts from earlier in this webinar. So a palliative care or a hospice team will still involve your primary care physician, neurologist. There may be a palliative care or a hospice specialist that can include physicians, but also a team of people, nurses, social workers, and others. It often includes pastors or religious advisors or counselors who help both the person living with the disease and also the caregivers and family. And when we think about this time of the disease, we also still think about the goals. So what are your and your loved ones' goals and values? What is the team that can help you accomplish those goals and values? And then what are the treatments that help with those goals and values? So that could be relieving pain or relieving other bothersome symptoms, or targeting what you and your loved one want for this late time of life. So there are many other examples of reassessment and reevaluation, but this is one that many people with Lewy body dementia ultimately face. So in this webinar, we talked about 5 things. We talked about the importance of knowing yourself and your loved one, and this is really a wide-ranging thing, knowing what you love, knowing your values, and knowing what parts of the Lewy body dementia need to be targeted for you, and then also knowing the environment in which that happens. Helping your medical team know you and your loved one, what's important to you and what's coming up in your life. Identifying your team, both medically and then also in the broader context, and using those different team members to target those values and needs in different ways. We talked about this shared decision-making approach to partnering with your medical team and what that looks like. And then we also talked about the importance of reassessing both how you're treating your disease, reassessing your goals and your values, reassessing if something's working for you, and then also reassessing what your priorities are over time. So those are the main points that I wanted to discuss in this webinar today about partnering with your medical team. And we've left some time for questions and answers. So Angela, I'm going to open the floor to you.
Okay, thank you, Dr. Armstrong. This was a very, very insightful presentation. So we've received a couple of questions as we had hoped throughout the presentation. The first one is from Leon, and Leon asks, a lot of this seems to relate to the patient at home. What about those where the person with LBD is already in memory care? What about issues having to do with the kind of care one gets in assisted living circumstances? So how can people partner with their providers once somebody is living in long-term care?
That is a really great question, because you want to make sure that you are partnering with your team in whatever circumstance that is. So I still think it's important to know what your values are and what your loved one's values are, and figuring out how that intersects with the care at the memory care facility. And that can take different routes. So, one option or one place it comes up is the medical team approach. So as you work with those physicians and those nurses, the values and goals can enter into what kinds of medications are tried, what kinds of medications are avoided, what medicines do they really need, and what medicines probably aren't having that big of a difference. Or, if anxiety is a big deal, let's make sure that we're targeting that. So there are all those medical questions. And then I think there are also the questions about how do we live life to the fullest in memory care. So depending on the type of facility that you're at and where your loved one is in the disease, are there resources that your loved one would really enjoy? So some places offer pet therapy. So is that something that would really enhance your loved one's experience? Some places have music therapy where there is a harpist, for example, that comes to visit. How do we make sure that your loved one gets to that kind of encounter? Some places have games, but maybe that's something that your loved one doesn't like. So talking to the staff about, hey, that opportunity really isn't a good match and just causes more anxiety than enjoyment. So some of it will also enter into what kinds of activities are available and how do you make that happen. There could also be circumstances where you want to work with the facility to figure out how to make a good family visit. So can the loved one leave the facility for a short time, or can you use their lounge to have family come to your loved one? And so I think there's still an important role for thinking about what is important to your loved one and what different opportunities are there, either from a medicine perspective or the perspective of opportunities at the memory care unit or visiting opportunities. How do we make good use of those to prioritize the things that they value and enjoy?
Wonderful, thank you. I hope that answers your question, Leon. We have another question, and I'll stay on the theme of long-term care while we're here. How does one decide, either as a family or in partnership with the physician, that it's time to consider long-term care versus continuing to keep the person with LBD at home? How do you make the decision? How much is the doctor involved in that? So that would be a wonderful topic for everybody, I think.
Yeah, so that's a great question. It's highly individual, but I will tell you kind of some of the general things I discuss with my patients and families. So one way this often comes up is it safe? Because whether physically or cognitively or emotionally, sometimes it gets to the point where it's just not safe for the person with Lewy body dementia to be at home anymore, or maybe not safe for the caregiver. So if someone with Lewy body dementia, let's say it's the husband, if he is falling frequently, that's a big risk for him, but it may also be that his wife is small and is having a lot of trouble getting him back up again, and that could put her at risk for injury. So I think the obvious time this discussion comes up is if there are real safety concerns where it just isn't safe for someone to be at home anymore. But often it's not entirely clear if that's the case. And it really is figuring out the best environment for someone. And really, I do think it often is looking at the whole family unit, what's best for the person with LBD and for their family. So it's something good for everyone. I encourage people to think about it in advance, because one thing I think that is important is if you're going to take that step, which is hard for many families, is to find a place that is a good match for you. So looking at local places, you want it to be local so you can visit. You want it to be a place that you are comfortable with your loved one being. It needs to fit your financial resources. And doing some of that work ahead of time lets you find a place that is the best possible match for you and addresses, again, your values and priorities within the resources that you have. The other thing that I often point out is that many families see it as a negative thing or something to be avoided if at all possible, but it can actually be a really wonderful thing in some circumstances, because if there is a caregiver at home with someone with Lewy body dementia, that relationship has really changed. Where it used to be a wife and a husband, now it is a caregiver and a care recipient. There's not a lot of room for the marriage when there's a caregiver and a care recipient, or if it's a child, a daughter who's giving the care. It's really not the parent-child role anymore, but it's, again, caregiver and care recipient. And so by looking at memory care units, where someone else can take on that caregiving role, it gives an opportunity for some restoration of that relationship. Now, obviously, the marriage isn't going to be quite the same as it was before Lewy body dementia. The disease interferes. But the spouse can visit and be a spouse again, talk about what's happening in their family, read a book out loud, maybe in some circumstances play cards. And it's more of an even relationship and more of a spousal relationship and less of this caregiver-care recipient relationship that's really distorted the original relationship. And so when thinking about that, you want to think about safety issues. You want to think about what's best for you and what's best for the person with the disease. But I encourage you to think broadly about how this might be a good thing and how this could restore some things that are somewhat broken now just by the nature of the disease. So those are some of the things I talk about with my patients and their families.
Thank you very much. All right, we have our next question is along the lines of safety, which you brought up earlier, but it's from a person living with LBD. And this individual says, I like to travel, but I feel anxious about traveling with LBD. Could you discuss strategies or a resource to assist for myself and my care partner that would allow us to travel? Is that an opportunity for a conversation with a doctor?
I think that's a great opportunity, and I'm so glad that you're on the call. I struggle with the webinar whether to use my language targeting caregivers or targeting patients. So certainly, I hope there were elements in this webinar relevant to both. And I think some of the elements about how to travel well with Lewy body dementia will vary a lot from person to person because of the different circumstances, especially with the disease. So for example, if there's a large physical component, a lot of the Parkinson's symptoms, I encourage people who love to travel to really make use of anything that can make that travel physically easier. So for example, if you are going to fly, we talk about using, the wheelchair to get you on and off the plane, even if you don't technically need it, using that so you don't have to get so anxious about if you freeze on the jetway, for example. Just make use of the cars in the airport so you don't have to worry about hurrying between flights with a walking problem, the wheelchair onto the plane so you don't have to worry about freezing of gait. It can be very hard to turn around in those narrow plane bathrooms, so you can try to target that by making sure you go to the bathroom before the plane flight, or maybe flying places that are closer, so you might not have to use that narrow space. And then we also talk about how to dose Parkinson's disease medications if you have time changes. So anything that you can use to make it easier and smoother, I encourage my patients to do that. I do think routine is really valuable. And sometimes I think the travel is better and easier earlier in the disease. As the Lewy body dementia progresses, it gets more challenging. And so at those stages, I encourage people to do things more like smaller trips, so local trips where you don't have to cross many time zones. Maybe you try a weekend trip. Or sometimes families come to me and say, we want to do this week-long cruise. What should we do? And I often encourage them to do a test run with a smaller trip first to see if it will work, because it's much better to find out in a weekend jaunt that traveling just isn't working anymore than to get on the cruise ship with no way to get off and have it be a disaster. So the exact type of recommendation I give is going to be targeting the specific individual and what they struggle with in their circumstances. But I think there are some ways that your medical team can help you be flexible in targeting the things that are either a barrier to you traveling or that are making you most anxious about traveling.
Wonderful, wonderful. So we have a question that comes in that's specific to the physician that is caring for a person, caring for that person's LBD symptoms in general. So there's somebody who's a neurologist. This person is a question from Leon again, actually. Says, what if your physician, specifically a neurologist, is hard to get in to see? Because we know for many people, these are very, very busy clinics. You might have a long delay to get in. And also, how do you work with a physician who may not communicate well, even though they're quite knowledgeable about the disease? This pairs with the question I was thinking might be helpful for this audience as well, is how do you know when it's time to change doctors? So, so talk to us about working with very, very busy clinical practices. How do we know how to get the attention that we need when something is going on in between visits?
So that's a great question. So from my own practice, I would say that for some of these things, I don't always need to see a patient in person to address some of these concerns. So if one of my patients between visits is now contemplating a trip or has family coming into town, those are things that don't require a physical exam or an in-person assessment to discuss. And so I encourage my patients to reach out to me to discuss those kinds of issues, either by phone or through the patient portals that most physician offices have now. So those are great kind of one-off questions that don't necessarily require an in-person visit, so that you can reach out to your physician or the advanced practice providers to discuss. And they may also be able to, through their responses, connect you to resources through the LBDA or through Parkinson's organizations if there's some existing guidance on these types of issues. There is no doubt that this kind of partnership works better with some medical professionals than others. So this idea of shared decision making is in some ways a more recent one. There's, physicians have been doing this for years, but also we know that, farther back in the years, there was a more paternalistic approach to medicine where doctors told people what to do. And we're really getting beyond that now, but there is still a wide variety of different physicians and a wide variety of different approaches, and this will be easier with some physicians than others. I think some strategies that can be helpful is if you've identified something as a particular priority, that having 3 bullets or 3 questions can be really helpful to make sure that you are using your time well. And I do have people who come to me with 15 questions and we try to address them all, but I sometimes worry that we're losing the most important ones and trying to get them all answered. And so I think if you've identified something of particular importance, make sure that that's the focus of either your phone calls or your in-person visits. With regards to switching a physician, that is really challenging. And it's going to be challenging based on where you live too. I think if you live in a more rural area, you probably don't have a lot of choices, and so it's making the best of what you have. If you live in a more urban area, or if you live in one of the states with these centers of excellence, then you will have, more opportunities to switch or see different providers. I do think it's important to have a physician that you trust and who you can communicate with, because if you can't tell them what you need and have them respond, then ultimately that's not going to be a relationship that's addressing the needs that you have. But the details of switching can be challenging, especially if you don't have a lot of options.
Okay, thank you very much. Kim has a question, which I think is actually a fairly common one, and that is, how much should the family caregiver discuss with the person who has LBD about their diagnosis, about the symptoms or the progression or what they might expect? How much information is too much information, and how much is too little?
So that is another great question, and I think highly individual. So in some of the research that I've been doing with the LBDA, we've talked to some patients and families who say that the patient wants to know everything. They want to know what they have. They want to know what to expect. They want to be involved in all aspects of care. And then there are other patients and families who say, the patient just does not want to know. They're not interested in the details. They'd rather leave everything to the decisions of the family, and they prefer just not to be informed. And the approach that I usually take is in the clinic with the family present. I usually ask the person living with Lewy body dementia exactly what they want. So that, especially if it's early in the disease and, they can tell me well. And then I target what I say and what I ask to their desires. So if they tell me I want to know everything, then we go over everything as a group, hopefully in terms that they understand, and I give them opportunities to ask questions. And then it doesn't come up very often in my clinic, but if they told me that they just wanted to leave everything to their loved ones, that they didn't really want to talk about it or didn't want to know, then I would meet separately with the family. And sometimes, I'll meet separately with the family anyway if they say, look, there's something we really need to talk about, but my loved one's embarrassed or I'm embarrassed and we can't have this conversation frankly. Sometimes I'll have some of those conversations out of the room. But I try to pose that question to the person with the Lewy body dementia, so we make sure that we're open in communication about what they want and can target those goals and needs. And then that gets harder later in the disease, where that can be a hard question for people to process and answer. But I really try to have that conversation frankly, so I know what they want.
Wonderful. Thank you very much. All right, so we have a question from Bill. Now, his question is more complicated, so I'm going to simplify it so that it's really relevant to more people here on the call, and that's about hospitalization. What can families do to partner well with the hospital-based healthcare providers, and what do they need to make sure that their neurologist and their family doctor knows about their loved one's hospitalization?
That's a great question. So when people with Lewy body dementia are in the hospital, no matter what it's for, there is a risk that they will get more confused, they'll hallucinate more. Sometimes we see that the memory and thinking can worsen, or the Parkinson's symptoms can worsen, even when the hospital stay has nothing to do with the Lewy body dementia. And then that they can take a while to get back to their prior baseline after the hospital stay. I think some of the most important things for the hospital providers to know is that there are certain classes of medications in Lewy body dementia that are really bad for patients. And the big one we think about are the antipsychotics. So those are medications that help with hallucinations. Now, a lot of older people can have hallucinations when they're in the hospital. They get confused because they're sick or they've had a surgery. And sometimes these antipsychotics are used to calm them down so that they don't hurt themselves, especially after a surgical procedure. But those same medications that can be helpful for some older individuals can be very harmful in dementia with Lewy bodies and Lewy body dementia. And those are medications like haloperidol, Haldol, risperidol, risperidone. Those are very concerning. So the Lewy Body Dementia Association actually has a pocket card that you can put in your wallet that mentions those medications that can be bad for people with Lewy body dementia. And so I encourage you to have that wallet card or something similar that you have that you can share with your providers in the hospital so that they know about this disease, and so they know that some of these medications that can be used can actually make things worse for your loved one.
Okay, thank you very much. I know that the hospitalization is one of those issues that that most families with LBD face at some point in time. The other thing that I always encourage families to do is to bring some LBDA printed materials with them to help the nursing staff learn a little bit more about what their family's needs are. We are about a minute away from the top of the hour, so I want to thank you again, Dr. Armstrong, for joining us today. It was a wonderful presentation, and I'd like to thank all of the attendees as well for taking time out of their day to join us. All of these webinars are recorded and posted on LBDA's YouTube page. So again, please feel free to send that link along. You will be receiving it by email. To learn more about LBDA's Research Centers of Excellence program, please visit our website. The Centers of Excellence website address is lbda.org/RCOE, and that's for Research Centers of Excellence. We encourage everyone in the LBD community to consider participating in research in some way. So you can find some studies that are currently recruiting on our website at the link shown here as well. Lastly, most of our programs are made possible through individual donations. If you'd like to make a gift, please visit lbda.org. You can make it online. You can also call our office at 404-935-6444. Thank you again for attending LBDA's webinar. We hope you enjoy the rest of the day. Bye-bye.